Welcome to our daily Facebook Live event. Today we're going to talk about resources, basically the idea of how to get help and give help in response to our COVID-19 pandemic. I'm Steve Hollis. I'm the Human Services Manager for the Columbia-Boone County Department of Public Health and Human Services. And with me is my colleague Joanne Nelson. I'll let Joanne introduce herself.
Hello everybody, my name is Joanne Nelson and I am the Director of the Boone County Community Services Department. I'm helping Steve out in our response to everything that is needed in the human services area.
Thank you, and we have our fabulous interpreter here with us today, so big thanks to her. I'd like to start first with reminding folks that we have most of the information that we're trying to push out on our como.gov website. That's como.gov/coronavirus, coronavirus. And off that site, we have added links last night for get help and give help. So you can just go to that main site and then get to the get help and give help pages. And so that's what we're going to talk about today. I'm going to start with give help. The City of Columbia and Boone County have partnered with the Heart of Missouri United Way, and the Community Foundation of Central Missouri to work on donations management. Our friend and colleague Lee Kotwitz, who is the city's manager of neighborhood services, Lee oversees many things, but one of those things is volunteer efforts for the city. In Boone County's Emergency Operations Plan, Lee's office is designated as the lead agency for volunteer and donations management. So Lee is leading that effort, and we, through that effort, have partnered with the United Way and the Community Foundation to take in cash donations and also to take in volunteer opportunities. The website where we're managing that, and if you go to our website, the como.gov coronavirus site, there is a link to give help. And that website is comohelps.org. That's comohelps.org. Okay. There you'll find opportunities to give cash donations to the United Way and the Community Foundation, and also a link to our volunteering website. The United Way is going to use those donations to support local health and human service nonprofits. The Community Foundation will use the donations more regionally to support other nonprofits, but also prioritize needs coming from our incident command structure. And that's really important to understand. We do this so that, frankly, we can control the resources to some degree. The reason why that's important, and I've responded to many disasters over the years, is that mostly what we see is incredible generosity, but sometimes both money and donations go to things that may or may not be a priority for the leadership in the community. And again, we use an incident command structure to drive the identification of needs, the prioritization of needs, and then the prioritization of resources to meet those needs. So a good example that we often run into, we often see things like clothing donated. And again, this comes from a really good place for people. But what happens is we wind up having to manage a lot of stuff. At this point, we have no identified need for day-to-day clothing. So we want to get out ahead of this and really lead at this point with cash donations. Cash is really what we need right now, and that's because we have some critical needs both on the health side and on the human service side. On the human service side, we're really working to meet basic needs if at all possible. So we're looking at things like food, shelter, medicines, things like that. On the health side, there is a critical shortage of personal protective equipment, so that may be something that's an example of something that we might use donations for. Right now, those are being prioritized to first responders and healthcare providers. Again, it's always a little awkward to tell people how to give, but we're here today to tell you the most useful type of donation at this point is a cash donation. Again, we encourage you to go to comohelps.org to find those links to make those donations. Then on the other side is giving of time. Now we're doing that very carefully, but volunteerism is important. We often use volunteers in disasters. And in this case, at this time, what we're doing is we're advertising volunteer needs for agencies. So if we've communicated with most of our nonprofit partners, but if there are partners out there that haven't let us know if they need volunteers, we will post those needs. The other thing that we're doing is we're banking unaffiliated volunteers. In other words, people that just want to help, but maybe not at any certain agency. We keep a list of those folks so that as we identify volunteer needs as part of our emergency response, then we can assign volunteers. And again, we're doing that very safely. We're thinking about our directives for social distancing and things like that. So that's really kind of a summary of how folks can give help at this time. And just one more time, we're posting most of that information at comohelps.org. And again, you can get to that from the city's main coronavirus webpage as well. Joanne, do you have anything to add?
No, just it's really important to listen to what Steve said about the help that people need and what to follow the website and get that information that Steve had mentioned earlier.
And I'll just add, speaking of stuff or things, the Office of Emergency Management is going to really direct the donation of things. We have to be really careful because of health concerns about donated items and the people possibly receiving those donated items. But also they really want to be focused on what we need. So at this point, I would say stay tuned as a community for what the Office of Emergency Management identifies as the top needs for donations of things. Okay. Should we move on to get help?
Get help.
Okay.
I think that's and the next important item that we need to cover for individuals. And the website again is?
So basically just go to that como.gov/coronavirus website and then look for the link to get help. It's real easy to find. It's up on the left side of the page in the main toolbar. And that will take you to a special page that Joanne and I and some other colleagues worked on all day yesterday. I think the first thing I want to say is that is absolutely not a comprehensive list of all the services that folks might need. So let's start with how people can mainly get help. And you want to talk about that?
Yeah. If you can look at that, it's broken down into individual categories. There's something for food, there's something for health care, there's something there for, no, I'm forgetting something. Childcare. So we go to those, and like Steve said, it's not we're trying to get as comprehensive as we can. And some of that information is evolving even as we speak. I may hang up the phone 1 minute and get a call and something else changes. So we are trying to keep everything updated. Specifically for the food items, we're trying to make sure to have up-to-date information on food pantries, what's happening at the food, sorry, I lost my train of thought. For the schools, we're going to make sure that all that information is updated. We're currently trying to reach out not only to the local schools, but the rural schools as well, and making sure that we have that information in there about food. We're working with the services for independent living, and we're reaching out to others like Aging Best to see if they can make food deliveries for people who can't get out of their house. So we're working with them on trying to find drivers to make those deliveries. So those are some things as far as food goes, and making sure we can get those deliveries made to folks, or helping people go shopping when they can go shopping.
Yeah, thanks, Joanne. I'll back up just one step. Here's what we tell people in disasters. We have an incredible resource in this state called 211. That is actually run by United Way in St. Louis. That is a service that is run 24/7, and it's a place to get and give help. In this case, we are encouraging people who need help to call 211, okay, and they will refer folks to local resources to meet their needs. Okay, on the Get Help side, we've set that up, or I'm sorry, excuse me, Give Help side, we've set that up and we've described that earlier in this talk. And to give help, we want folks to go to comohelps.org. But to get help, really our first line is 211, and it's just such a great resource. I've been doing this long enough that we used to have to set up phone banks at the local level to take requests from folks needing help. And we don't mind doing that, but as folks might imagine, that's a really tough thing to staff. So 211 in my career in human services has just been a huge asset. So 211, that's available online, or you can just dial 211. That information is at the very top of our Get Help page on the city website, okay? So that's kind of our first line of getting requests for help. On our page then, we haven't tried to replicate everything. We've just really focused on the top issues that are kind of applicable to this COVID-19 response at this time. And Joanne mentioned, right now we're really focused on food, healthcare, mental health, childcare, and then we've also got some things linked on unemployment benefits and things like that. This is a really unusual disaster. Usually when I respond to disasters, we're in response mode and we're working on shelter, clothing, food. And then we move into what we call long-term recovery and we work on jobs and unemployment. We're kind of having to do those two things at once. And our friend and colleague Randy Cole at the City of Columbia's housing programs, I've asked him to run our long-term recovery response because I can't run two functions at once. And Randy's working with the Chamber of Commerce, READY, and other entities looking at things like income replacement, small business support, supporting our nonprofits. So that is happening in parallel process, and we may have Randy and others come in and talk about our long-term recovery. It's just a very unusual disaster because it's so slow moving and so widespread. So I did want to mention that. We do have a little bit of information on our site for social service providers. We're having folks email us to collect needs for resources to continue to deliver critical services. So those emails go to humanservices@como.gov, humanservices@como.gov, and that's on our Get Help webpage. And then we are posting business-related information on the Chamber of Commerce website, and that's at the bottom. A link is at the bottom of our Get Help page. But let's get back to individual needs for help. And I think Ashton's going to ask us some common questions, and we're going to try to answer those. And then again, we encourage you to ask questions through Facebook.
So if someone reaches out for help, is their information confidential?
Yes, it is. 211, if you call 211, it's totally confidential. Again, it's 24/7. And then that referral is confidential. And then all of the nonprofit providers have confidentiality policies.
They all are required by any of our contracts that theirs, and that no names are given. They have to be HIPAA compliant.
So also with this pandemic, a lot of people are out of work right now. Where would someone go to file for unemployment because of COVID-19?
Yeah, we have that link on Get Help, and that's the state. And they have, I looked at the website yesterday, and they've got really good, clear information. That's probably the best place to go because that's a state program. We're just going to continue to link to that website. And again, that's on Get Help. And it sounds like they'll be handling any of the additional resources that come down from the federal government.
I would highly recommend that you call or email somebody before you actually drive down there. Just my understanding is some of the state offices are starting to close their doors just for anybody who walks in. So please just give them a call or email them.
You know, Joanne, you make a great point. I think with almost any of these services, it's a great idea to call or email before you go. I know many of them are trying to handle requests and helping over the phone. In fact, I know our own social services here, we are really mainly trying to do over the phone or email.
I know they can reach out to state, but we have had a lot of people ask if their employer shuts down temporarily because of COVID-19, do they qualify for unemployment benefits?
Boy, I am not an expert on unemployment.
I don't
and
know
so
enough about unemployment.
I think it's always safe to just refer folks to talk to the unemployment folks at the state, because I think the other thing is some of this could be changing just because of the really unique nature of this situation.
Yeah, I think the federal government's still trying to work through their process of what it's going to look like. So, you know, here again, it's just the theme you're going to hear. It's ever changing. You know, new news is coming out all the time.
Where can people reach out for free food and that food maybe to be delivered if they need it?
Yeah, we're really, one of our key partners and a major stakeholder for us year-round is the food bank. They're a great partner to us. That's one of the first agencies we started working with as we prepared to respond. They have shifted to, we think, a safe way to distribute food through their central pantry that's here in Columbia.
Right.
And it's basically drive up.
Right.
They do need volunteers to help with that because it's pretty staff intensive.
Right, and we are currently working on, they have a list right now of what they consider food pantries that was available before the pandemic. So one of my staff is actually working on contacting all the food pantries to see what pantries are going to be open, what their hours are going to be, and how they're going to handle any types of people driving up to get food. So that's why it's so important to kind of refer back to this website and remember to look at what we're going to have listed, because we are, as we speak, trying to make that update on the food pantries that are available.
On home delivered meals, we have 3 programs that do that year-round. Most of those do those for lower-income seniors. We have Meals on Wheels, we have Services for Independent Living, and they actually do grocery shopping and delivery. And then we have Aging Best, formerly known as Central Missouri Area Agency on Aging. They are all still running. They do have eligibility requirements, so we've put their phone numbers and websites on our Get Help page. We're working very closely with those agencies to be sure they can remain open, and even possibly, if we can, expand their capacity. Those are the 3 programs that we're working with on home delivered meals. We also have on our page a link to the Convention of Visitors Bureau, the city's Convention of Visitors Bureau. They are keeping a list of restaurants that are providing free food, and then they're also keeping a list of restaurants that are providing drive-up, pickup, and delivery. We're not going to try to manage all that on our Get Help site, but we do have links to the Convention of Visitors Bureau site. Those would not necessarily be eligibility-based programs. A lot of what we're listing on Get Help may be eligibility-based, but if you need help, ask. We'd rather have folks ask, so call 211, or if you see a resource that you need, give them a call, okay?
Yeah, if you want to talk a little bit more about medical insurance, if people are in need of that.
Absolutely. So that's an issue that we struggle with throughout the year, and now during the pandemic, it's obviously a challenge. Well, let me first say that we are not doing testing for COVID-19 here at the Department of Public Health and Human Services. We are not testing here. We've got great information about testing on our COVID-19, our coronavirus website. So look for information about testing. What Joanne and I want to talk about today is if you're sick, and it doesn't need to be, COVID-19. We have an incredible partner here, our federally qualified health center, the Family Health Center, which shares space with us here at our department next door. They are our amazing provider of sliding fee scale coverage, healthcare coverage for Boone County folks. And so if you're sick, if you need to see somebody, we do want to encourage you, don't walk in, call them And their website and phone number is on our Get Help page. And again, that's the Family Health Center.
I also want to add to that, we're talking about physical health quite a bit, but there's also a mental health aspect of this. And we are working on the Get Help. There's going to be a whole section on help for adults, and then there's going to be a section for adults, children, youth, and families. And so we ask that you please, don't forget your mental health. That's so important during this time. And it's gonna be rough. The news, when you turn it on, is not always good. And so we're asking you, don't be afraid to reach out. There are resources available. Additional resources are gonna be made available as we move on through this process. And it's, you may not need it now, but you may need it later, but please don't be embarrassed to reach out to these mental health supports that we have listed on the Get Help page.
Yeah, and just a little detail on the page, what we've got are some resources listed by adults and children, as Joanne mentioned. Let me first say that at the top of the mental health section, we have the Borough Behavioral Health Crisis Line listed. If you or someone you know is having a mental health crisis or has thoughts of suicide, please call that 800 number. They're open 24/7. They are the state of Missouri contracted mental health provider in our region. So that's the number that we have up for crises. For adults, our partners for accessible mental health services are Borough Behavioral Health and Compass Health. There are many others, but those are two of our key partners that can provide mental health care for folks that may not have coverage or may struggle to pay for that. And then for children, we're really encouraging folks to contact the Family Access Center. I'm going to have Joanne talk about that.
Yeah, we're working closely with the Family Access Center for Excellence, also known as FACE. And they are creating some type of a crisis call line that you can call, and they are working on being able to set you up immediately with some help to speak to counselors. And we're highly encouraging you to call. Children, youth, and families, you can call 573-771-3223 if you're just needing to find out about who you can talk to, and they're going to hook you up right away with a list of possible therapists that you could talk to. It could be for one time, it could be multiple times. Like I said, we're going to be having a conference call later with them today about the possibility of more funding for mental health. So just keep your eyes and ears open, go to Get Help again, and ask those questions.
Also along the healthcare lines, we've listed all the Boone County pharmacies and their hours and whether or not they deliver. So that's also on the Get Help site. And I want to talk about medication. We have a medication assistance program here for low-income folks. Again, if you need meds, feel free to reach out to us here at Public Health and Human Services, or again, always feel free to contact 211 and they'll refer to providers like us. We know medications can be a challenge. We have some incredible pharmacies here, and we work closely with a lot of those guys, and actually have several that deliver. But if you're struggling with medicine, give 211 a shout. And if you're having trouble affording your medicine, give us a shout. We don't have unlimited resources, and it's a tough issue all year, even tougher now, but we're working on that. And let me just say, we are also tracking needs carefully so that we can try to meet those with the resources that we have. And we are going to be in the unfortunate situation where we have to prioritize certain needs and certain groups of folks. But I promise you, we do a lot of this, and we are going to do the best we can to try to meet the needs. Let me just say, some of these services are intended for low-income people, so do keep that in mind. If you have the resources to meet your needs, let's say you have a question about getting your medicine, just how to get it to you, that's different than getting someone to pay for that for you. So we're all in this together. Joanne and I work in human services year-round, and we're always in a resource-scarce environment. There's never enough to meet all the needs. And so just keep in mind that that if we can save some of these services, or actually a good chunk of the social services for folks that just otherwise can't get them, we can. But I also want to say, I want to reiterate, if you need something, call 211. I'm working daily with 211 to try to understand what they couldn't help with, and then we'll try to work on those issues.
We've had questions specifically about how to help the homeless, especially when it comes to clothing and things like that. What would you recommend?
That's a great question. I've been working day and night on homelessness. Unfortunately, the Room at the Inn winter shelter that we run each year in partnership with our local faith community closed. We have expanded Room at the Inn over the years. It went from 1 month to 2 months to now 3 months, but they did close in the middle of March. That means we have approximately 75 to 90 unsheltered folks. We know who those folks are because of our tremendous efforts as a community to address homelessness. We are in touch with those folks through our street outreach team. We have been able to keep Loaves and Fishes open, our soup kitchen, and then our Turning Point Day Center. Our incredible partner, Wilkes Boulevard United Methodist Church, supports both of those efforts. We are working extremely hard to try to find emergency shelter arrangement. I think we're very close. There'll be more to come on that. As we ask people to basically try to stay at home, you can't do that if you don't have a home. Out west, they have such overwhelming homeless populations that basically they've struggled to deal with that during COVID-19. In Columbia, this is an issue that we're really trying to tackle, and we're working hard on that as we speak to try to establish emergency shelter and try to get people off the streets. Don't necessarily need donations for that per se. What we need is cash donations for all the agencies that are working on this tough issue. Needless to say, we probably are not going to get a free shelter. I'm trying my best to do that, but we'll have costs there. The other thing, though, is that folks will need food. One of the easiest donations, if you were to donate stuff, is to give food or items to the food bank. The food bank is really our existing kind of intake for donations like food or household items. So talk to the food bank. Don't just show up, give them a shout. They'll give you instructions on how to safely do that. But back to homelessness, the way to support that is through our structures like the existing agencies. So donate to your favorite homeless service provider, donate to comohelps.org, or donate things to existing places like the food bank. That's an issue near and dear to my heart and one we're really working hard to fix.
Probably the last question for today will be about face masks. There's been a lot of people wanting to make homemade face masks, and if they can donate them, what do you all know about that right now?
Yeah, I mentioned earlier, the Office of Emergency Management is really wanting, understandably, to keep pretty tight reins on donated things, and in particular, personal protective equipment. I am not a medical professional. It's my understanding that those things, according to CDC guidance, can be used as a very last resort. But what I would ask at this point is that the community wait for a directive from the Office of Emergency Management about homemade masks and shields.
Awesome. You guys just want to plug the website one more time?
Yeah, so again, probably the easiest place to find everything you need is our como.gov/coronavirus website. Once again, from there you can link to the Give Help page, you can link to the Get Help page, but as we've discussed earlier, it's also where you can find health information and other information about the COVID-19 pandemic.
Thank you.
Thank you, everyone.